name is Janet Poole, and I am the director of the Occupational Therapy Graduate Program at the University of New Mexico. And I will be talking about taking care of your hands and face, the importance of stretches, assistive devices, and protection. I do have a financial relationship to disclose in that I have research support from the National Scleroderma Foundation. So my objectives for this morning are to discuss guidelines for stretching exercises, to teach stretching exercises for the hands and the face, and explore assistive devices to accomplish tasks of daily living, protect the fingers and hands, and compensate for decreased hand function. So some general guidelines for stretching exercises, and some people call them range of motion, is that heat and massage can be done before doing the exercises because that helps warm up the tissues. Range of motion and stretching exercises should be aggressive and be started before there's obvious deformities. So before hands or fingers start to get contracted, but they start to feel tight, people should do the exercises. And these exercises should be done even with ulcers, although modify the exercise. Sometimes people have an ulcer on the back of their fingers or the tip, and I know they're very painful. I've heard that. But again, you still need to try and move the joints around the sores so that they don't get really stiff while the sore is healing. There are several modalities that people can use to manage pain and increase joint motion. There's heat modalities. Some of those can be moist heat, and moist heat includes like paraffin, baths, or hot packs. There's also dry heat. And I have a picture in a few minutes that shows a fluidotherapy. It's a machine, but it needs to be done in an OT or PT clinic. Then massage can also be used to sort of warm up and increase mobility of tissue before doing stretching exercises. There's connective tissue massage, there's manual lymph drainage, and there's lymphatouch or physio-touch. So again, do the heat and massage before doing the stretching exercises to warm up the tissues. And this slide shows some examples of heat or hot packs. You can get commercially available hot packs or heat packs, in your local store, your department store, your pharmacy, and just put them in the microwave and warm them up. However, you can also do the economy version, which is taking a pair of sock and putting a cup of rice in it, dry uncooked rice, and then tying a knot in it and putting it in the microwave and warming it up. So that's an option also. And then at the bottom, that machine, that's a fluidotherapy machine, and it has dry heat. So I said you need to go to a PT or OT office that has that. And people put their hands in that netting there, and then it's like dried corn husks that are kind of all crunchy and smashed, and they rotate around and they cause like a heat. So that can be very nice for people too. And then this slide shows the paraffin wax, and many of you may have this at home or have used it if you've had therapy. But what it is wax there in the machine, and it has some oil in it, so it helps to moisturize the hands. So the paraffin increases the tissue extensibility. It can decrease pain because of the heat, and because of the oils in the paraffin, it helps add moisture to the skin. Usually use it at about 120 to 130 degrees Fahrenheit. You can use like a thermometer, a meat thermometer, to put it in to make sure it's not too hot. Some of them have dials on it to help adjust it. If you put your hand in and it does feel too hot, then lower the temperature and let the heat go down. Do not use paraffin with open sores. So if you do have wounds or ulcers on your fingers or hands, don't use the paraffin. And basically, you place your dip your hands in the paraffin, pull it out, put it in, pull it out, and you do that about 4 times. And then you place the dipped hands. You can place them in plastic bags or wrap them in saran wrap. You may need to only do one hand at a time, or if you have somebody around to help you, you can do both hands. And then you wrap the hands that are in the plastic bags or saran wrap in heavy towels or in oven mitts, and then you keep it on for about 10 or 15 minutes. And you can see in the bottom right picture there that it looks kind of like it looks like a glove when the wax is on. And so people can then, when they're done, is they can just peel that off and put it back into the paraffin bath. And then you can reuse it until the wax itself in the paraffin bath starts to turn like a yellow, or for lack of a better word, just starts to look kind of yucky. But it does really help, and a lot of people really do like this. And then you can do your hand exercises. So this slide shows some different types of massage. The one on the top left, the LymphaTouch or PhysioTouch, is a negative pressure device that mobilizes tissue and can decrease edema. Sometimes people with scleroderma have edema in the early stages. And the device there has to be done, again, by an occupational or physical therapist in a clinic. Then the one on the right, the connective tissue massage, is a deep stretching massage. And that can help decrease some pain and increase like mobility of the tissues. And so with that one, again, it's usually probably more comforting to have somebody else do the massage for you, but you could do your own massage with that. And it's just a nice massage that helps to loosen up everything. And then at the bottom, the manual lymph drainage, that is for mobilizing, it's a mobilizing massage, and it moves the fluid through from the hand or the fingers into the larger vessels of the forearm and then the upper arm. And oftentimes this too is used in the early edema stages, because some people with scleroderma, as I said, have some swelling in the beginning of their disease. So it starts at the kind of the fingertips, and then people try and move the tissue, the massage therapist or the OT or PT, up into the bigger vessels in the forearm. Again, a lot of people can do this themselves. It depends on their hand function, but it is sometimes nice to have somebody else do it for you. So the stretching exercises, the purpose is to prevent or slow down the development of contractures. Contractures just mean your joints don't fully extend or fully flex like they should or like they did before. It's important to do these frequently and beyond resistance. Maintain a position of stretch for 3 to 5 seconds, even if the skin blanches or kind of turns white a little bit. A lot of you, probably most of you, have Raynaud's, and sometimes if you're making a tight fist, you may notice that your fingers or hands get a little bit white. That's okay for those 3 to 5 seconds, but then if you're like making a fist and it starts to turn white, then make sure that you straighten your fingers, let all the blood flow go back in it, and maybe do the other hand. And again, I talked about how these stretching exercises should be done before there's any noticeable loss of motion. And one thing I think is really important is to think about these exercises as kind of, you take pills, medication for a lot of different symptoms, and the exercises should be kind of thought that way too. They need to be done every day, a couple of times a day. You can do them when you're, if you're watching television, if you're just sitting there, if you're at a meeting, your hands are under the table, or whatever it is, to try and get them done several times a day. So this one shows some range of motion exercises for flexion. Flexion means bending. So for the MCP joint, which is the knuckle joint of your hand, the big joints across your knuckles here. So as you can see in the picture, what I want you to do, and I'm hoping you're doing this as I'm talking, is to make a fist, and you should, ideally there should be like about a 90-degree angle here, and some of you may be tighter or not be able to do that. So then you can use, as in the picture, the palm or heel of your other hand to push on top of this part of your finger to try and help it bend more, like the picture in the slide. So he's trying to make a fist, and then he's using the palm of his other hand to push on the back of the fingers to try and get them to stretch. And then there's smaller joints in your fingers too. So for those, bend all the joints of one finger to touch the tip of your try and touch the tip of your hand. You can bend all of them if you want to at the same time. And then gently use the other hand to push. I'm trying to show different angles here, but you can see in the picture there on the slide, gently push with the other hand to stretch. Now you can do one finger at a time. If your fingers are pretty similar, meaning that they all sort of bend the same in each joint, then you can do all of them at once. But if you have one finger that is kind of an outlier, doesn't bend as much as the other fingers, then you may want to do some individual stretching of that. And it's okay, like I said, if the other fingers bend at the same time. And you can see in that slide there how the person's finger, the index finger there that's being bent, and also the other hand, is starting to turn a little bit white. So after you hold the stretch for about 3 to 5 seconds, then straighten the finger out, let the blood flow go back into that finger, and then you could just do the same thing with the other hand, the index finger on the other hand. So you can switch back and forth. So as the blood flow comes back into one finger, you go on to the next finger. Like I said, that can take a fair bit of time. So if your fingers are pretty similar in how much they bend or straighten, sometimes you can do them all together. The PIP joint, that's the proximal interphalangeal joint. That's the middle joint of your finger, and that oftentimes does get really bent, slightly or really bent in people who have scleroderma. So there's several exercises on the slide for that. So the one on the top left there is the person is pushing their hands on a flat surface. So you can all do this with me. If you have a table, you can push it down on the table. If you're next to a wall, you can use a book to do it. It has to be a hard surface though. You can use your lap, but your lap is not hard. So your fingers may actually bend around your thighs. Put it on a flat surface and then put the back of your other hand on the back of it across these joints like in the picture to try and push them into straightening more so that they're flat against the hard surface. So the other one is press the fingers against each other. So it's like a prayer position. So you can put your hands together. The goal is for all surfaces of the fingers to touch both hands or both sets of fingers and the palm of your hand, like in the picture that. And if your fingers are kind of contracted like this, then your goal is to try and push them against each other so that they try and flatten out a little bit. So those two at the top work pretty well if your fingers are, like I said, similar. They don't straighten similarly. If you have one finger that's really bent and the other fingers are pretty straight, then you may need to do one of the ones at the bottom. And those use 3 points of pressure. So I'll show you can look at the picture in the slides. So I'm going to put so we're going to work on the middle joint of the finger. So I'm going to put my index finger of my other hand on the palm side of my finger. I'll use my index. I'm going to put my tall finger at the bottom of that joint. I'm going to put my thumb over the back of the joint, like that. So then what I'm trying to do is I'm trying to use my thumb to push the finger straight and use these two fingers on this side to help counteract that. And the picture in the middle there might show it a little better. This might be easier for some people. And that the person puts their hand on a table, puts again their thumb over the back of the PIP joint, that middle joint in the finger, and then uses their index finger, the other hand, to try and lift up the tip of the finger off of the hard surface with that. And that is really good if you have one or two fingers that are stiffer or won't go as straight as the other ones. And again, you can see some of the whiteness there, as it really is some pressure on the fingers, but it is needed. And then the person, I would tell the person to go on and do either the index finger of the other hand or go on to do another finger so the blood flow can come back. And then the picture on the right is really similar to the bottom picture on the left, but you can see the person there has some contractures, and it's a little harder to do, and you can see the color changes there. Some people have quite severe contractures in their fingers. Person on the left there and the little finger is quite bent, and she's trying to wrap it around like the end of a table and then pull back to straighten it. And then the person in the other slide on the right has pretty severely contracted fingers. All the stretching in the world at that point in time, depending on how long the contracture has been there, may not be able to get a lot more of motion back. However, by doing these exercises, so she's hooking her fingers over a chair, it could be over a table, and then trying to pull back a little bit to just get some space there. Hopefully it will help maybe keep the fingers from getting more tight and more contracted with that. But it probably, if somebody's fingers are that contracted, it probably won't be able to straighten them out unless something surgical is done with that. Okay, moving on to some exercises to help spread the fingers. So also in scleroderma, because of the tight skin, we have web spaces between our fingers. Those are web spaces. And those can get really tight too. And our web spaces are important to be able to do that. You can see in the bottom picture, you know, when we keyboard, or if some people may play musical instruments, they really need to be able to spread those fingers wide. You also need to do that if you wear gloves for any reason. Mittens you probably don't, but gloves you definitely do. So one thing to do would be to interlace the fingers, like clasp your hands together, and your goal is to slide the fingers so they're all the way down, touching the web spaces on both hands. So my hands can do that pretty easily, but the person on the left there, you can see that the fingers are tight enough. The goal is to have the fingers go all the way down into that web space. But sometimes over time and stretching and really trying to push that can help increase that motion. A gentleman with scleroderma told me what he did was he slid a bottle cap between his fingers, because a lot of people do. Now we're using our own bottles, so the caps are bigger and that sometimes doesn't work. But if people are still using smaller water bottles, they can just slide that down in the website and just kind of hold it there. And he says he can do that at a meeting or anywhere that he is, because, you know, most of us are carrying around some type of device, a water bottle these days. And then we'll move on to the thumb here. So the thumb also becomes tight with people with scleroderma. And we also have a web space here in our thumb. And that allows us to stretch us out to pick up like large cups, large objects to hold them. And that can become tight in people with scleroderma. And we call, in the OT and PT world, we call that abduction. So the picture on the top right, or top left, excuse me, shows the person putting her index fingers together and then her thumbs. And then the goal is to just stretch those to make that space wider, like in the arrows in the picture. And again, if you try and do that, you can feel a little bit of stretch there in the web space. Another way to do it on the bottom left there is to hook the thumb over, could be a table, could be anything a person has, a chair arm, and just sort of pull down, hook the thumb all the way to the web space and then try and pull the hand away. And that can help stretch that out too. And then the picture on the right is for thumb flexion or bending. So the person is trying to touch the tip of their thumb to the bottom of their little finger. And you can see it's hard to do there, but that's the goal. So the person would stretch and try and do that. If it doesn't reach, like in the picture, what you could do, and I'm not sure if I can show this, but you can put your hand over the thumb, your other hand, and try and push the thumb towards, so the tip does touch the little finger. And that helps with the mobility of the thumb. And then for the wrist, because a lot of what we do, the hand has more power when our wrists are extended or straightened a little bit. So the picture on the left there shows wrist extension, which is really bringing your wrist back like that. So the person puts their hand palm up, and then uses the other palm of the hand to push in a little bit of extension. So what you're trying to get is that. Now wrist flexion, or bending the wrist, person bends the wrist, uses the back of the hand to try and push down a little bit in flexion. Now for this one, I'm going to caution you to not push, not stretch, not really push on that. It doesn't have to go to 90 degrees, just gently stretch, because within this, all this stuff here is your carpal tunnel, and that's where one of the nerves does that innervates all your fingers, and there are a lot of blood vessels in there, and so you don't want to put too much pressure on that, or you could compress that nerve a little bit and cause some problems. So it's just really, and for most of what we do, most of us don't have to bend our wrists that much. It just makes it easier to fasten some things, but so you don't really have to push on that. So splints, or orthosis. A lot of times people, OTs, PTs, use splints to help with deformities, like to increase the motion in a joint in the finger that is slightly contracted. The problem is, you can see in the picture there, there's that little cuff that goes under the finger, and that's hooked up to this thing we call an outrigger, and there's a rubber band. But anyway, that pressure under the finger there actually can cause people to have Raynaud, because it puts a lot of compression on the blood vessels there. So we really don't use those splints with people with scleroderma. So if your OT or PT wants to use one, they need to watch very carefully, because your finger could turn white almost as soon as they put that on, and the tension would be way too much for that. So unless you're seeing that person like every couple of days, I would not recommend that. But splints can be used and are good to protect ulcers on fingers. And the two pictures over on the right show some different splints that could protect, like if you have an ulcer on the tip of your finger, both of those could be helpful to protect that from being hit on whatever it is that you're doing. So sometimes what happens when people have scleroderma is that they may see a PT or OT or listen to somebody like me who says, do these exercises. And then somebody says, well, my hands are fine. They move fine. And that's great if they move fine. I hope that they stay that way. But sometimes the tightness starts to sneak up on people. And they don't really think about how maybe some motion has been lost until maybe you go to put on a pair of gloves or mittens, or you reach into a pocket and your fingers don't go straight. So to monitor how much you can straighten your fingers or extend them is you can draw a hand outline, like in the picture there, to help monitor finger extension. So you just put your hand on a piece of paper, and you can do it, or you can have a friend do it, a family member, child, grandchild, and draw like a picture, kind of like, we do make turkeys for Thanksgiving. And then what you do is that's your outline, and put a date on it. And then what people need to do is every now and then they need to put their hand on that picture, like on the right, and maybe push down a little bit and make sure that their fingers go all the way, their fingertips, all the way to the tip of the drawing. If their fingers don't and they've gotten tight, they really need to work on those exercises that I showed you before, putting your hands like this, putting them flat on the table, and the 3 points of pressure to try and increase the motion in those joints. So the other joint that's important in scleroderma is this knuckle joint, or MCP joint. A lot of time people get hands that look kind of like this. They have a lot of bending at the middle joint, and then the knuckle joint doesn't bend as much. So this just shows you can make some templates, or have somebody help you make templates, or tell your OT and PT to make templates. And that reminds me, which I forgot to say in the beginning, I think my email address is on that first slide, and feel free to give my email address. You can email me, but you can also give my email address to, if you're seeing an OT or PT and they have any questions, just make sure whoever sends me an email puts scleroderma in the topic so that I know what it is and I will read it. Sorry to digress there a little bit, but anyway, here's some templates here to monitor the flexion. You can just cut out little templates for each joint, or you can even take like 2 pieces of paper or whatever people have. You may need help with that. 2 pens and have somebody look at what the angle is of the finger, put it of, you know, family member on top of your finger, and then try and tape those together and try and make a template. And then again, you just monitor it. If your fingers are pretty much the same, meaning they bend almost the same, you may need one for, you may just need one. You may need one for each finger because they may all be very different. Just kind of name them like in the bottom, you know, right index, middle right, so that you can keep track of them. It's kind of a pain, but it's one way for you to take control and monitor if you are starting to have some decreased motion. And then it really is important that you do those stretching exercises. Other ways to keep track of how much your finger bends is to see if you can put small objects like a pencil and have the pencil would be in contact with all of your finger, or like the palm side of all the fingers. You can see in the 2 pictures in the bottom, she's trying to make a fist. She does really good, but her fingertips don't really touch the palm of her hand there. On the one hand, on the right there, all the fingers do, but the index finger. You have to be a little bit careful with that because a lot of us can touch their fingers to their hand, but this joint is really not, like I said, it should be at about a 90-degree angle. Thumb, to keep that thumb web space is to, or the abduction, is to find the largest size of object that will fit in the web space with all sides of the web space touching the object. So in the picture on the top left there, you can see person's holding the water bottle, but all parts, all sides of the web space here are in contact with that bottle. Same with the red one at the bottom. But then with the can, you can see there's a big gap there. So that object is too large. So I would recommend the person use one of the bottle sizes on the left, but with the goal to eventually be able to hold the can on the right with that. And again, it can be water bottles, it can be soup cans, spice jars, whatever fits in that web space really nicely. But it's a way, you could also use this as a way to just stretch out the web space. Instead of doing this, you could just put that big object in there and have that in there for, hold it for 3 to 5 seconds. Okay, moving on. So the hand is connected to the wrist and the elbow and the shoulders. And although the shoulder joint and the elbow are really important for, you know, using our hands up in space. So for the upper extremity, like the shoulder joints, the one on the top left is for shoulder flexion, which is really bringing your arms up way over your head. You can see that she has her hands against a wall. You can walk your hands up a wall. You can do it inside a door frame. You can do it inside a door frame. I don't know if when you were little, my parents and I kept track of my kids' heights by putting these little pencil marks on the inside, but you could do that to a door frame, have somebody mark where your fingers go. And really what you do is you're leaning against, like in the picture there, to really try and stretch the shoulder joint out in this space. Now you can also do that lying on your back in bed. You have to be away from the wall, so maybe sideways across the bed. Bring your arms up over your head and just let gravity pull your arms back up. But they can't be like that. They have to be like this to really get that shoulder flexion. And then the other thing that's important is shoulder extension, or expanding kind of our rib cage here in our chest area. I think these days, a lot of us, you know, we're typing on your computer, you're really holding your Kindle, you're just, everybody's sitting like this, and to really stretch that out. So the lady in the picture there is putting her hands together and then behind her back, and then she's trying to raise. This is hard to show in this picture, but I think you can see it. She's trying to raise her arms away from her body to stretch out this area. And then the picture on the right there, she's doing external rotation. So putting her hands behind the back of her neck there, and then trying to bring her elbows way out to the side. Like if you're against a door like she is, trying to touch your elbows to the door. And you could also, again, do that in bed, laying on your back, and then put your hands like that and kind of let gravity put that. You could also use one of those yoga rolls or even a towel roll between your shoulder blades, and that helps stretch all that out too. And then at the bottom, so one of the motions we have palms up, we call that pronation or supination, and palms down, we call pronation. So if you put your elbows into your side, bend your elbows, put them into your side, turn your palms up, your palms should go pretty darn flat. And if they don't, they're like that, then it can be hard to kind of do some different activities that we do. Most time people can pronate palms down pretty easily. So for this one, the person has a rolling pin in their hand, and what he's going to do is he's got the rolling pin one way and he's going to supinate, go palms up with one hand, and then use the rolling pin, the handle of the rolling pin, like in the picture on the bottom right, to kind of put some stretch there and to supinate or do the palms up with that. You don't have to use a rolling pin. A pen really doesn't work, but you probably, even a kitchen tool might work, a spatula, something that is kind of long, a ruler might work also, a hammer, a lightweight hammer might work also, where the hammer head would go to help to use some gravity and the weight to push into supination. But a lot of times, again, people don't really notice that because we do a lot of things like this, but our shoulders end up doing it. So the way to tell if you need to work on this is elbows bent to 90 and then do palms up, and the palms should go pretty flat. Okay, we're going to move on now to face and temporomandibular joint exercises, which is really this jaw joint here that you all have. Because a lot of times in scleroderma, or not even with scleroderma, but with all of us, you know, go to the dentist, dental hygienists, our dental providers need to get into our mouth, so our mouth needs to open wide. We need to have good mouth opening to be able to brush our teeth, to be able to floss back there, and then also to eat our big yummy sandwiches, our burgers that we want to eat that look so good. And then speaking, I mean, when we talk, a lot of times too, you know, we use our mouth and we open our mouth to make different sounds. And because of the face gets tight and some of the connective tissue and the tendons can get tight, a lot of times people do lose some mouth opening ability. And sometimes people don't know about it until they're going to visit their dentist or their hygienist, and the dentist or hygienist all of a sudden has a hard time getting in somebody's mouth to take care of their teeth or clean their teeth. So massage or heat can also be done on the face, and you can massage your skin yourself by just doing different massage, moving the skin around. Like I said, it's always nicer to have somebody else do it for you, but that does cost money, but you can still do the facial massages yourself. Also on the face, heat, warm towels on the face. I'm doing these in the shower. So the exercises I'm going to show next may want to do with a lot of people around, but you can do them in the shower. And then that warm water that's on your face loosens up the tissue, and you can do the stretching exercises better. So mouth and face exercises. So I'm assuming, of course, that everybody watching this is doing this along with me. So everybody open your mouth wide as you can. And hold it. And again, you hold it for about 3 to 5 seconds. And you can count 1, 1,000, 2, 1,000, 3, 1,000, so you don't do too fast. Then you can purse your lips. Going to kiss somebody, blow out something. A big cheesy smile, you know, show all your teeth, because that stretches those muscles there, that skin. You can puff up your cheeks, like you've got a lot of air in it. And then oftentimes people with scleroderma, like their lips are kind of retracting a little bit. They just kind of move back. They have some lines. So people can curl their lips over their teeth, and that's just trying to curl your lips over your teeth. If you can't do that, your lips are not that mobile, your skin isn't, you can always use the thumb and the index finger, like the person on the bottom right, and kind of pull the upper lip over the lower lip. to help, again, try and stretch out some of this tissue here. Again, it's perfect to do in the shower, right? You don't want to do it around maybe anybody. These are a couple other mouth stretching exercises. And there is actually research that shows that doing these mouth stretching exercises did increase people's ability to open their mouth by a little bit, and made it easier for hygienists, dental personnel to take care of their teeth. So the one on the left here is manual stretching of the mouth and the lips. Both of them are. So one of them on the left there, take your right thumb and put it in the left corner of your mouth, and then your left thumb and put it in the right corner of your mouth, and then you just stretch. And again, you hold it. Now, if you have like sores, or if this really hurts, or you have dry lips, put Vaseline, down here and all over your lips before you do this, because that will help keep it, a little moist. And then the other way that the person is doing it over on the upper right is putting 2 fingers in and really trying to stretch out the lips too. So both ways are fine. Kind of depends on what feels better and what people can do. And then the one at the bottom is called oral augmentation with tongue depressors. So somebody gets a pile of tongue depressors, put a rubber band around one end of it, but you have to try, it's trial and error to see what fits, but you're trying to put them at an angle from the front teeth, like your incisors, to the back molars of the opposite side. And then that gives a stretch to really try and open the mouth wider. And then because you have them rubber band together, you can insert more tongue depressors as somebody's mouth opening increases. Now, for this one, I would not recommend that you do this until you've talked to your dental personnel about it, because some people may have jaw problems or TMJ. So if we're doing anything like that bottom one, is to make sure you talk to your dental personnel. You can still open your mouth as wide as you can, like in the shower and in the previous slide there, but don't put the tongue depressors in unless you talk to your dental provider. There are some mouth opening exercisers and splints. There's the Aura Stretch, Press, and Therabite. There is little to no evidence of these being effective with people with scleroderma. So again, check with your dental professionals before trying or using these devices, because if people have jaw problems or TMJ, this could really be a problem. So don't use any of these devices unless you've talked to your dental provider and get their thoughts. Now, mouth opening, we talked about why it's important. And again, sometimes people don't notice that their mouth opening is starting to decrease, as we don't all go around opening our mouth as wide as we can all the time, except for when we go to the dentist, right? They're the ones that seem to know all this about our mouth. So a couple of things to do is to just kind of keep track of this. And you can open your mouth as wide as possible and measure from the bottom of the front teeth to the top of the bottom teeth. And you can make a card or find an object that might be the same width. So you might, again, need somebody to help you with this. Or you can just hold the index card up like the person at the bottom is, and then if you have a marker, you can mark where that is. And then you can hold that up to, the mirror, and you can see if mouth opening is starting to decrease. Like she's still opening her mouth that wide, but if she was opening it and didn't open that wide, you may need to really make sure that she does some of those other exercises to kind of monitor that. Because again, it is something that people don't really think about and you don't really keep track of until maybe go to the dentist or trying to eat something big that you haven't eaten in a while. Okay, so I'm going to move on here from the stretching exercises to the next part of the talk, which is assistive or adapted devices. Because they oftentimes are used to compensate for some of the hand difficulties or hand function limitations that people have with scleroderma. So one thing is different cups. Sometimes cups with big handles, like the one on the upper left, can work well. Some people like goblets. Wine glasses, because they have the smaller stem that makes it easier to hold on. The other one is more of an hourglass shape that's smaller at the bottom. Again, it depends on how much opening people have here and how much contractures they may have in their fingers. Sometimes too, people pick up their cups by the top, the brim of the cup, and use it that way. And straws, straws always work fine too. The picture on the upper right there is a universal cup. It's got a little pocket on the underside where the handle of the spoon is stuck in. So if people have really severely contracted fingers and can't maybe hold on to things very well with just their thumb against their finger, they might be able to try something like that. There are built-up handles. There's foam that people can get, pipe insulation material, oftentimes at your local hardware store. You can have people cut off pieces of that. Sometimes too, when you tell people what you're using it for, because you say, I don't want this big piece, I just want this little piece about 6 inches long. Sometimes people are just willing to do that for you when you tell them what it's used for. But those can help too. You can wrap tape around it, but if you have the ones with the hole, then you can interchange the objects that you need to use. Dressing devices, there's billion, and I should say too, you can Google all this stuff and you come up with everything under the sun. Can also have, like, if you're part of a support group or an active group, you can have people have show and tell, even if you do it through Zoom or virtually, to bring their piece of equipment that there's their favorite piece that they cannot live without that helps them, and then learn about what other people use. So there's different types of button hooks you can use if you need to wear shirts with buttons. Other thing is to not wear shirts with buttons, but sometimes people need to. There's a zipper pull that hooks around that little hole in your zipper and can pull it up. But you can also put rings in zippers, which can make it easier. The one with the pocket there with the green string, sometimes clothing comes with those types of things on zippers. The bottom in the middle shows using a button hook. And then sometimes people have a hard time reaching their feet and to put on shoes and socks. So the purple item there is a sock aid. Just fold it, pull the sock over it, and then got the long handles there, and put it down at your feet, put your foot in it and pull it, and the sock will come on. And then there's a long handled shoe horn there. People have a hard time reaching down to get their shoes on. Key holders, using keys. One thing these days is our cars are getting fancier and we aren't having to use keys as much to open things. Some of you may have push buttons that start the car. Some of us don't, but that can be helpful. And also now the key fobs that are on most cars are actually bigger than those little skinny keys that we used to have. So different devices to help hold keys. That shows a push button pill organizer. Sometimes it's hard to open the ones that have the tab on them. The open it medication bottle. Sometimes, it goes when you open up like any type of medication these days, even over the counter, sometimes they have that silver piece in it that's just really hard to get off. This can help a little bit with that. Or you have the blister packs, so you have to pop those pills out. That can be, very, very hard to do. You have decreased hand function. Good Grips and Osco have a lot of different tools that you can often find in a local department store to help, with getting containers. Like sometimes the lids off of the plastic containers are hard. This one you push it down, it suctions, you push it again, and the little handle pops up. There's something for everything. This shows jar and can openers. A lot of these are pictures that devices people have told me, what people with scleroderma have told me are great. There's the one on the top left there is one you mount on the bottom of it, like a cupboard or cabinet, and it's kind of in a V shape, so different sizes fit in it, has kind of teeth. Put your mayonnaise or whatever in there, and then you can use both hands to twist it. There's the jar popper for like soup cans and pop cans, that have that tab you have to get off. Let's see here. The ones in the middle there are different openers that have either grips or tabs or things that you can try and do. There's always electric can openers, but they don't work for everything. They work for a lot of things. Like you can use the old-fashioned jar or can opener, but those are usually kind of difficult too. So there's all sorts of things to do. This shows another one, 5-in-1 all-purpose opener. Just can, sometimes best to get one device that can do a lot of different things. The multi-opener on the left, somebody sent me that. That was their favorite tool. The MediGrip bottle openers and the Dysum. So a lot of things are hard to do, but if you have like that rubber there that gives a little bit of kind of traction, that can help you open things. Then I wanted to talk a little bit, because we spent time on mouth opening, of some of the oral hygiene equipment that's out there. And a lot of people already have this, because now much of this is in mainstream and we all use it. But you can electric toothbrushes. A lot more people have those these days, and they do a nice job. Water jets. There's curved bristle toothbrushes. There are children's toothbrushes. Sometimes people with scleroderma, their mouth opening is decreased enough that they can't really get in there. Sometimes the dentists have to use smaller child-sized tools to be able to do that. But children's toothbrushes can work. Put large handles on them. There's flossers, there's picks, there's all types of things. There's different dental flossing. Flossing teeth can be really hard. Sometimes the picks and the water picks help a lot, and we'll take care of that. But there's the actual tape. Sometimes it's hard if people have hand function problems, but there's long handled ones that you just put in. And then there's a smaller one like the purple one that a lot of people use these days. And then moving on here from devices to just keeping hands dexterous. These Chinese health balls, Qigong balls, they come in small sizes, just trying to manipulate them in the hand, picking up small coins and other objects, just trying to pick up things to keep the fingers mobile. If people do play instruments or anything like that, of doing that, because that helps keep all, your fingers kind of flexible. There's some little dexterity exercises there, just moving fingers one at a time. Needlecraft can help. Be careful with the needles. Touching fingers to thumb quickly, just a dexterity. Lifting and lowering your fingers one at a time from a table. So anything to kind of keep the hands mobile and active. And then I'm going to move on here to protection management of Raynaud's phenomenon, because the more severe symptoms are usually seen in the hand. So making sure that people insulate their hands from the cold, strong detergent, irritating chemicals and bacteria. And this is stuff that you probably already do and you already know, but just trying to remind you. Dress warmly. There's heating vests that you can wear to kind of help keep your core warm, or just down vests. Chemical hand warmers, I think these are just wonderful, because they do actually keep the heat for a while, and you can buy a ton of them at a time and put them in your pockets, or even in your gloves, and that can help keep your hands warm. Avoiding cold temperatures, you already know that. Taking care of skin, keeping your skin moist, maintaining circulation, and biofeedback. There is some biofeedback out there that you really think about, being warm and warm thoughts, and how warm it is. Some of you have lived in temperature this summer where you've had a lot of heat, and try to think about how warm it is when you go outside. Sometimes that can help. More ideas. There are now heated keyboards. There's heated mouses that people can get. These are things too, if you're a working person in a really cold office, that you can ask for accommodations. There's those wrist sleeves. You can put the chemical heat packs in there, and that will help keep it even warmer. If you remember that sock I showed you way back that was in the microwave with the rice, you could heat something like that too, and maybe sew the end of it, and then you could put that in front of your keyboard and rest your hands on that, your forearms or wrists on that, to help keep your hands warm that way too. Warm car solutions. Remote car starters. Sometimes those are expensive. Sometimes people have told me that they've asked for those for, like, a holiday gift, and that's what they've told their family they want, that, but nothing else. Everybody go and chip in on it together. They're heated seats or covers or steering wheels. Some people have cars like that already, but those can be really helpful. The remote starters, and it can get it all warmed up and starting. Accessible parking. Some people have told me that they've asked for that for accommodations, not just a handicap, but also parking in a garage if that's their workplace or their apartment has that. Mainly a workplace, you can get the accommodations, but then also like a like a carport. Some workplaces have that. And then if you live in a climate where you actually have to shovel snow, then you hopefully won't have to shovel it, and then it can help in the really hot climates too. These wristies that are out there, again, you can put the hot packs in them. There's all sorts of these koozies that fit over cans now, so that doesn't get your cans cold. And then all sorts of gloves. Protection of ulcers during ADLs, because those can be pretty painful. Again, I talked about insulating hands from the cold, strong detergents, irritating chemicals, and bacteria by wearing gloves. Avoid tasks that risk fingertip trauma, hitting your fingers, whatever you're doing. But you can protect your fingertips. The picture there on the right has that finger sleeve. It's kind of got gel inside, and it is kind of padded a little bit. The one right underneath that is a finger sleeve that can fit on, but on the back there, it would help cover the PIP joint if somebody had was developing a sore there or had a scar, and it's got a padding in there. And then the bottom in the middle kind of shows some of those. And then splints that I talked about earlier, that's putting splints on can also help protect the fingers. Now, I think it would be very difficult to type with a set of splints on, but you know, that could be an option if need be. Other ideas to protect the fingers, their guitar fingers. Somebody suggested that the plastic little things you put on your fingers that have the holes in them may be better because they allow more air to get through. Some people use new skin to help protect their fingers. The cohesive bandages you can often get, then that will actually can stay on your fingers. You put if you have an ulcer, put that on, put your dressing on it, and then you could put that over, but it's like tape, it sticks to itself. And then you can actually move the rest of your hands with that. And then, but then you can take it off if you need to, or when you wash your hands or change it. Keyboarding, I guess I have to say in my time here, in the last several years, there's been so many changes in technology that we really don't have to use a keyboard anymore. There's all the text to type. And when all that first came out with the first Dragon, it really was hard to kind of understand what people are saying. But now we use it all the time on our phones, on our computers. I think that is just really awesome, and I think that really helps a lot. Touch screens or styluses for touch screens if you need that, or for some people if they have bandages on their fingers, or sometimes people's fingers with the Raynauds, they don't really work as well on that. But one thing is to avoid static positioning causing potential compression, because compression, like holding your cell phone in your hand for quite a while, you know, it can cut off the circulation to your fingers, especially on that little finger there, depending on how you hold it. People use those little pockets on the back of their phone. Some people have rings they can put their hand in, a stylus, just, you know, putting the phone on a stand, the keyboard on a stand. People use Kindles to read instead of holding it like that, you know, putting it up against something. Different ways to keep the fingers moist. I put these in here because I thought they were interesting. I have no evidence that they really help keep hands moist, but I thought they were an interesting idea. If anybody ever tries it, please let me know if you like it or not, but they help keep your hands moisturized. I live in a very dry climate, so I think this would be really great for that. Some people live in more humid climates and may not need that as much. So then in conclusion, talk about hand and face, and using heat and massage can be done before you use those exercises, the hand and face exercises to warm up your tissue. The range of motion stretching should be done before there's obvious deformities, should be fairly aggressive, meaning you really need to hold the stretch, or before there's loss of mouth opening. And then to really try and monitor your hand motion and your mouth motion, because that hopefully will help you start doing the exercises before there's any real loss of function. Exercise and stretch all hand joints, but concentrate on the joints that are the tightest. And range of motion and stretching should be done even with ulcers, although modify the exercises. If the ulcer's on the fingertip of a finger, then try and make sure that you work on this finger and get that finger to move, just so that the whole finger doesn't get tight or stiff while you're waiting for the ulcer to heal. Take care of your hands, keep them warm, protect your skin. And then I had some resources here. Taking Charge of Systemic Sclerosis, an internet program. There are also ideas in there for Raynaud's, and also there's some videos in there of the hand and face exercises that may be helpful. And then also ones for the legs, because I really didn't cover that. There's also a brochure, stretching exercises for the face and hand, on the Scleroderma Foundation website. And I had, when I gave this talk originally, some different studies that are available. They're still open. You can contact me. And then the website. So like I said, there's assistive devices out there for probably anything, but really look at them. Try and ask other people with scleroderma what they found work for them, so that you don't buy something that doesn't work. If you do it and it doesn't work, it'd be helpful to other people to know that too. And so thank you very much.